Alright guys, so we'll actually be looking at the pharmacology of statins. That's a group of drugs that are usually used in lowering what? Cholesterol levels in the body. Statins. Now, for these statins, it's not a regular pharmacology. We have some specific headings that will be looking at these statins because this is an exam question. So we're answering it in a way that your lecturer will actually want to see it being presented. Right? So pharmacology of statins. So for pharmacology of statins, it's like this. Statins are actually what? 3-hydroxy 3-methyl glutamyl. Okay, that's a H is what? This one, right? M is this one, right? G is what? This one. So they're actually supposed to put this in brackets, not slash. Right? So they inhibit this enzyme. Now that enzyme is very important in the production of cholesterol. So you inhibit that enzyme, you reduce the production of cholesterol in the body. Do you understand? Examples of statins include Lovastatin, Fluvastatin, Simvastatin, Atorvastatin, and Rosuvastatin. I think there's a Pravastatin or something. Then there's another one. I think there are like two more are not here. Okay, so can you see that this is the pathway for the production of cholesterol? Now statins have a way of what? Attacking this enzyme. Once your enzyme attack this enzyme, everything is cut off, nothing works again. So these statins are most effective in reducing what? Low density lipoprotein cholesterol. So other effects of these statins include that they decrease what? Oxidative stress and vascular inflammation with increased stability of what? Atherosclerotic plaques. You understand? So this is statin. So what is their chemistry? They are actually structural analogues of the enzyme. Do you understand? So they possess a side group that is similar to the enzyme. Right? So that's why the enzyme will feel like, okay, this is my guy. But when they come to the enzyme, they harm it. Do you understand? So all statins are administered in active what? Beta hydroxide acid form, except for Lovastatin and Simvastatin, which are administered in lactone form. Okay, as a prodrug, I must be hydrolyzed to the corresponding what? Beta hydroxide acid. Right. So all statins are subject to extensive first pass metabolism. Right. So just little of it will be in circulation. Right. Pitavastatin, Pravastatin. Okay. So mechanism of action, they actually exact their mechanism of action, which actually reduces the low density lipoproteins in plasma. Okay, because they inhibit the enzyme that is what? Needed for the production of what? Cholesterol. Understand? So therapeutic use, they can be used to treating different disease conditions like familial hypercholesterolemia, dyslipidemias, okay, and all of that. That's when you're having high levels of low density lipoproteins mostly in the body. So adverse effects, dyspepsia, headache, fatigue, hepatotoxicity, you understand? Um, myopathy, sometimes it can cause somewhat muscle diseases that will affect the skeletal muscles. Rhabdomyolysis is when there's breakdown of muscles, right? But those ones are rare, you get. So that's it for the pharmacology of statins.